It's a lot. When we first received our diagnosis, I remember the overwhelming feeling of drowning. It felt like we were out in the middle of the lake and waves were crashing around us and there was no answers in sight, no shoreline to be able to hold on to anything. And it's a lot. It takes a lot out of your family, it takes a lot out of yourself.
When a child is diagnosed with cancer, the whole family's life is turned upside down. You met with your oncology doctor and received a whole lot of information about the diagnosis and treatment of your child. That's an enormous amount of information and, like many other families, very difficult to absorb given at a difficult time. The diagnosis of cancer in a child produces depression, anxiety, concern in the family and the extended circle. This may be particularly true for First Nations families whose history with the colonial system make it particularly difficult to interact with the Western medical system with whom they are forced to interact. POGO and its hospital partners acknowledge that First Nations families newly diagnosed must have the opportunity to connect with important influences in their lives and other sources of support and advice. We acknowledge that treatment must begin in a spiritual way. Treatment is about more than medications and physiology. It is a spiritual journey. And finally, we all have to find a balance that recognizes that the need for support and community is critical, while ensuring that treatment begins as rapidly as possible to ensure the safety and well-being of the child.
I'm here to talk you through this video. You can watch it as many times as you want, at your own pace, and share it with people who you get advice from, elders, friends, community members. Miigwech.
Danse, Nikisiram was the Konimashki Kinedishnikas, gave Saskoti Kiunasikasun, Nahia Naktio Tumsamak Meti Irish and Dow. Hi, my name is Sean Kinsella. I'm director of the 8th Fire here, and we are currently filming in what we describe as Cookam's kitchen area, Cookam's basket space, and this is the Indigenous spaces at Centennial College. You can see around me that this room is modeled after an Anishinaabe roundhouse, and it is affectionately called Cookam's Basket Room or Grandmother's Basket Room because it has reminded a lot of our Indigenous faculty, staff, and community members of the baskets that grandmothers have made. So we're really grateful to be able to host. We're really grateful to be able to have folks film this today, and Miigwech for allowing us to facilitate this for you.
What does it mean when a child is diagnosed with cancer?
So our bodies are composed of cells, the building blocks of organs, and there are billions of cells, and they come together to form the organs of the body, the liver, the heart, the brain. In order to keep those organs in good shape, your body keeps making new cells. And that's particularly true in children because they have to grow. And so the cells are dividing all the time to ensure that that growth happens. They divide faster and more often so that a child is enabled to grow from a tiny baby to a great big adolescent.
Dr. Greenberg, we've all heard the word, but what exactly is cancer?
In some ways, cells are like motor cars. Motor cars have accelerators and brakes. The brake slows the car, the accelerator speeds the car, and the balance between the brake and the accelerator determines how fast the car goes. In a cell, the brake may fail and the accelerator may pick up, and when that happens, instead of dividing into two cells, the cell divides more and more times and makes multiple copies of itself. And as it does that, it makes errors in producing the cells, so that the many cells are abnormal. And they're abnormal in the fact that they can push normal tissue out of the way, like in bone marrow. They can invade organs where they ought not to be, and they can spread into the bloodstream and through the body. And that's what cancer is.
Before my family started this journey, the most I heard about cancer was lung cancer or cervix cancer, and most of them died. So what's the difference with childhood cancer?
So firstly, the kinds of cancers that children get are completely different. Adults typically get cancer of the esophagus, the bowel, the lung, the uterus, and as you say, they often have advanced cancer and die. Children get none of those cancers. In childhood, the most common cancer by far is cancer of the blood system, leukemia, lymphoma, and those two things are 50% of all childhood cancers. About a third of cancers are brain tumors in childhood, and then cancers of bone, muscle, and other organs fill in the rest. The second thing that's important about childhood cancer is the cells grow much more quickly. And that's a good thing in some ways, because the more rapidly cells are growing, the more susceptible they are to treatment.
So we know why adults get cancer. It could be environmental or a lifestyle choice, but why do children get cancer?
We don't know what causes childhood cancer for the majority of children. What we do know is that it has nothing to do with anything they have been exposed to. We know that it has nothing to do with anything that caregivers either gave the child to eat or provided them with in their environment, either after birth or in the womb. And it has nothing to do with environmental exposures. We do know that some cancers run in families, they have a genetic basis, and if we know that, we may look at other members of the family to be sure they're not at higher risk of getting cancer. I think the thing to really remember, though, is 85% of children are cured of their cancer. It's a very important statistic.
We went over what cancer is and how it differs in children. So what happens when your child is diagnosed with cancer? What are the preliminary steps?
So the first couple of things we have to do is to know that your child's body is working normally. So we test kidney and liver, mainly those organs, by blood tests and urine tests to be sure there's nothing else we need to deal with. And then we have to figure out what kind of cancer your child has. There are many different kinds of cancer. There are many big divisions of cancer and then a whole bunch of small divisions. So if you think of a tree is different to a shrub, is different to a flower, but within trees there are many different kinds. So there's poplars and spruces and pines and maples, and they're all different from each other.
Why does it matter that we know what kind of cancer it is, and how do we figure that out?
So different cancers respond to different kinds of treatment. There are many different kinds of chemotherapies, and the drug that is best suited, the drugs that are best suited to treat your child's cancer are determined in part by the kind of cancer. And it is very important that we know exactly what your child's cancer is, so we can pick the right medications, the right kinds of treatment, and figure out how much treatment the child may need. And to do that, we need a piece of tissue. And to get that, we do a biopsy.
So what is a biopsy?
So a biopsy is when a piece of a tumor, or in the case of a suspected leukemia, a piece of the bone marrow, is taken so that we can examine it in the lab. And in the lab, a variety of tests are done that allow us to make a very explicit and correct diagnosis of your child's tumor. And that helps guide us in selecting what kind of treatment, what kind of drugs, and what kind of protocol, and we'll talk about protocols later on, your child should be given in order to get the best cure rates with the least side effects?
On our journey, we had a lot of those tests, but we also had a lot of x-rays and other imagings. So what role does that play in diagnosis for childhood cancer?
It allows us to see what else is going on in the body. In children with leukemia, typically we will just do chest x-rays and bone x-rays. But for children with solid tumors outside the brain, we need to know more, and the way of getting at that is by imaging studies that actually allow us to look inside the body without getting inside the body, and so enable us to know whether there's been spread of tumor to other places, and therefore to pick the right treatment to get us the best outcome with the least side effects. And with all these tests being done, it'll take us a few days. And hard as it is to be patient, we ask you to be patient to ensure that we are operating with all available information to get the best possible results for your child.
On our journey, everything happened really fast at this point, and it was important to take the time to consult and just have conversation with our elders in our community, our family and friends, because everything was really moving fast. It was a big decision. So can you tell us what the treatment plan would be like for a newly diagnosed child?
It is important to be able to talk to family and elders. Treatment in childhood cancer can last longer than in adult treatment, but during that time the kids are well, and we encourage them going back to school and resuming normal life. What components of treatment and in which order your child will receive treatment varies with the kind of tumor that your child has. Treatment will include and always have chemotherapy, special medications that destroy tumor cells and stop new ones from forming. There are many different kinds of chemotherapy, and which one or ones will be used in your child depends again on the kind of tumor that it is. Also, depending on what kind of tumor it is, there may be some combination of chemotherapy, radiation therapy, and surgery. All oncology doctors follow treatment protocols.
During treatment, we heard that word a lot. Dr. Greenberg, can you explain what protocols are?
Protocols are roadmaps that tell us and you which medicines to give, in what order, and in what dose, what other ways of treatment need to be fitted into the order, and what imaging needs to be done at what point. Sometimes we vary from the plan, the roadmap, because of things determined by your child's reaction to the treatment, like low blood counts or infections. That may cause us to change the protocol or alter the exact order. All children in this province are treated in one of 5 POGO partner hospitals, and all the experts in all of those hospitals use exactly the same protocols.
My son Mackenzie was diagnosed when he was 2 years old. During his last treatment at Sick Kids, we had a long stay. We couldn't leave the hospital or the Toronto area. And so while we were staying there, we had to do our best to stay connected to our culture and our medicines. And so I did that by providing him with our traditional medicines while he was in the hospital or when we were in our apartment. And so this painting that I made, it shows the connection that we had, and it has the 7 grandfather teachings here in the root system that connect us to our Creator and to our community and our culture. On the side here, I didn't outline any of the IV pole or the IV because it's Western medicine, and even though he did need it for treatment, it wasn't part of our culture. It was something we had to work with in order to get him better. Part of his wish for every Indigenous child is to have that connection to their culture, even if we have to use Western medicine. And that's what this painting's about. There's a lot of talk about clinical trials. Can you describe what clinical trials are?
So clinical trials are detailed plans that outline a trial that compares new medications to what already exists or new combinations of medication to see whether we can do better with the new version than with the old. Some clinical trials look at radiation and either leaving out radiation or decreasing the dose, and some look to reduce the treatment with drugs, particularly if prior trials have shown very, very good results. Clinical trials are monitored and overseen by research ethics boards of experts from many disciplines that look at the science behind and the safety of all clinical trials. The Research Ethics Board ensures that all children who are eligible to be enrolled on the trials are treated on the trials if there is consent.
Is there a reason why we as an Indigenous family might feel that we don't want to participate?
You may feel hesitant, but the Research Ethics Board oversight and the fact that we enter all children whose parents consent, irrespective of what their ethnic background is, should reassure you that the decision is yours, but you can make it without concern about reasons for First Nations not to participate.
It's a lot. It was very overwhelming. The feeling of drowning, not knowing any of the answers, the outcome. But when you start to hear the plans that the doctors have made, when you start to have something to hang on to, the waves don't seem to be overwhelming, and you're able to see the shoreline again. And I think that's the most important part, is to be able to remember that once you start to see that shoreline, once you're able to get those answers, there's hope again. And that's what's most important. Remember what I said about the feeling of drowning? Hopefully this video will help you find the shore. Miigwech.